a very pertinent topic nowadays. AI has been in the news of late as well. And AI is also attached to a lot of concerns, I would say. So let me start with asking our Principal Secretary, sir, what do you see 2040 in Namma Bengaluru with regards to AI? How do you think it is going to change or transform or the healthcare system in our state, sir?
So thanks, and first of all, good afternoon to all of you. And I must state that I feel privileged to be part of this workshop being organized, or even being organized by Deccan Herald, which many of us consider to be one of the most fair and objective newspapers, I'll say. So with these words, I'll just, like to say, you asked me specifically on AI in health. What I would like to say is that in health now, computerization, automation, this is the time which is, this is the sector now, this will see a transformational change in coming years. Because now many things are coming which will definitely bring a lot of change. Few things I would like to mention is, one is this hospital management information system, which is now, of course, we take it for granted for all big corporate and private hospitals. We have to implement it in our government hospitals, and we have started a very nice model where lot of, this time, rather than either developing ourselves or taking a vendor through some tender route, we are going through a very, creative method. And we could do it because now we find lot of private developers are there in the field. So what we have basically done is, we have given one hospital to them. They will come and demonstrate, and they will implement the whole system, bring it up to the final stage. Then we empanel them, and among them, then we call tender. So this, this health sector, I feel, because I am in health sector and I see a lot of things from inside. This Government of India brought this Ayushman Bharat Digital Mission concept. So this trinity, what we get under Ayushman Bharat Digital Mission, this itself is going to revolutionize the way we organize the health sector. Of course, when it comes to AI, every sector AI will be touching. Recently, we had called tenders for teleradiology. Teleradiology, all of us understand, direct usage of AI is there in that. We did call tenders, some people participated, but we also, I must share, we also found it challenging how to evaluate, first of all. And how do you demonstrate? Because how do we quantify what is the AI capacity? That itself is such a subjective criteria. So I would like to take this opportunity, just to, among the audience or whoever this message goes, that please come and approach us in health department and tell us your ideas. We are a implementation department. We are in the treatment sector. Many times some people confuse us with, like a research organization. Sometimes some organizations come with new products and we are not able to accommodate because we do not have, we are not ICMR, we are not any validation technology. Whatever your technologies are established, please come to us and approach us. We would like to use as many as possible. So there are many sectors where this AI would be coming, and one or two sectors what we recognize is teleradiology. Even in this HMS system, Health Management Information System, the challenge was that how do you make the doctor use it? Because doctor in government hospital has a huge queue, and then you ask him to fill all these formats and all the fields, he can't do that. So now recently we were shown by one of the software providers, a software AI based. You speak in any language and you are conversing with your patient, that will keep on listening, and after that it will organize the data into the specific fields. So the doctor will be asking, what is your this thing, history and all that, parent had or something. So all that it will, beautifully pick up and organize. So this is something, now this is was the pain point for us in the implementation of the system. So once the technology takes care of that pain point, because if doctor is not on board, we can't have any hospital management system. So these are the kind of things which are coming, and a lot of opportunities there. Thanks.
Thank you so much, sir. And I think something very encouraging from someone who's an entrepreneur and develops medical devices that sir has offered for people to reach out, share their ideas, because the department is going to probably look at implementing some of these, and I think that's very promising to see. So Manish, sir, I would like to ask you a question. Running such a large MedTech manufacturing organization like Meril, for Bengaluru, I'm sure you've worked a lot with Karnataka and Bengaluru. 2040, what do you see as the healthcare future for Nanda Bengaluru?
Thank you, Deccan Herald, for this opportunity. It's indeed my pleasure. As you rightly said that Bengaluru should mean something to me. So when the invite came, I did not think even for a second, and I just said, yes, I'll make it despite whatever my schedule. Navigation was a technology which was not known to any surgical specialty, no matter what. And it started in neurosurgery, and the first ever country's navigation was installed by me, where I was working for some other company, in the year 1999 at Satya Sai Hospital in Whitefield in Bangalore. So that was first technology point which was introduced across the whole country, here in Bangalore city, right? So also, the first ever orthopedic navigation for knee and hip replacement was installed by Meril immediately right in the pandemic in the year 2020, December. First ever orthopedic robot in the country was installed at Sakra World Hospital. So these were a couple of landmark mentions that I feel that they're worth mentioning here because it's in Bengaluru. That said, over a period of time now, I mean, the technology, we just say that, yes, this is a Silicon Valley. The city has its own pros and the cons, and I know the session before discussed everything about traffic. And however, for the MedTech point of view, there are a few things that can be definitely implemented, and I see that it is going to be possible. We have Sir here who is implementation specialist. And so, first and foremost, I know that there is a good bio research park here. It's very close to Yelahanka area. I think that's a fantastic park where a lot of work is being done and the new startups exist there. Ironically, what I gather from people who do these startups and work there is the fact that they need a lot of funding and implementation things, which they find it difficult within any Indian company to go and look at that because the demand is quite high. So a lot of multinationals, they come, take the benefit and go. So that's one area where, as Bangalore is already getting benefit, but it can be benefited for the Indians and companies in India at large. That's A. B, Pina, we all of us know, has been there as an industrial estate here, right in Bengaluru city. Earlier it used to take 60, now it takes more than 90 minutes from airport to go. So I think, and then it has become quite old. You don't want any foreigner to come and see some things dug up there and stuff. So I think revamping that entire area of Pina is something as a second point which needs to be done. We all have heard about AMTZ, which has been a very successful thing in Vizag. And Dr. Sharma is spearheading that from the private as well as the government side. And then it is a very successful venture. So something like a AMTZ or a tech park, which is supported by PLI scheme, these are some things which need to happen. And the decade ahead of us, if these are the things which happen, backed by actual technology, AI is just one part of it. As it is, this is a Silicon Valley. It is all software. So, and of course, yeah, we have a BL here. And so a lot of infra needs are satisfied in Bengaluru city. So with these few inputs and a decade to go, I think I see no reason why Bengaluru cannot be spot on globally as well as number one in the country.
Wonderful. So I think with more stronger tech parks and backed by infrastructure and implementation, Bengaluru will definitely lead in the MedTech and healthcare front. Dr. Somashekhar sir, I had a question. See, I'm a doctor. I'm wearing a ring that monitors a lot of my vitals and tells me when I should stop doing some things or do some things. Recently, an AI company reached out to me saying that we want to create your AI avatar that can interact with patients and follow up with patients, not provide treatment, but provide that follow-up, talk to them, and all of these things are coming up. And I can also talk to my avatar for 99 rupees per month if I want. These kind of things are coming. So as a practicing surgeon and someone running the healthcare space, how do you see the next 10 years with all of these technologies coming into MedTech and healthcare, sir?
Absolutely. Thank you. You know, what is a very sad part in medical field, you know, you're a doctor and I'm a doctor and a surgeon. We have practiced now. I manage admin of a large hospital chain. Is our whole ecosystem of healthcare is sick patient treatment.
Yeah.
That is the worst a country can do. The most expensive way to make human beings normal is forgetting what's happening. When they become sick, spend all the infrastructure money to treat them. The most expensive way. Instead, we should concentrate on preventive health. Preventive health is applicable to mass screening, very economical and cheap, can make an impact on a society, nation and country, and reduce the burden on maximum amount of money spent on one individual to make them all right, with success rate ranging 50-60. Second point is errors in medicine. You know, the doctors are human being, you know, everybody thinks doctor is God, but we know, you know, I know nobody. You are just a human being. In that limit, we work. Errors in medical field are very large component of complications, morbidity, and financial toxicities. So this is where, you know, AI is very important for a human being. You have a brain. Imagine if there is somebody who can remove all these errors and do. Third point, if you see the way computer development, first IBM was like occupying this full room, then it became a small desktop, small Apple, then desktop, you know, then you have a laptop, now everything is on your phone. Now imagine the most expensive treatment in medical field is hospital-based. A patient calls you, say, come to hospital. See the finances, time, travel, come, one doctor, one person, admitting, room, bed. Instead of that, everything should move home care, home patient. This is where miniaturize of things come on wearable equipments. But to do wearable equipments, this equipment needs to be highly advanced and intelligent. So ring, patch, or you put, you know, initially you remember how they used to monitor diabetes, morning, evening, now everybody just wears a small patch and they go home and come back, Holter system. So how I would see is, this AI will remove the shift from expensive sick care to preventive care. More and more hospital-based care to home-based treatment. And errors of treatment is out, and then they will bridge between these people and those. So economical, error-free, easily accessible, economical. I don't want to use the term cheap, because cheap means people think not good. In India, you go, you like all Gucci bag, everything, very good. Something give with Indian brand, maybe, may not be. So highly economical, but yet high quality. So this is where AI is going to say. And people feel afraid, AI is going to replace a doctor. Never. It is a bridge, a companion to a good doctor. But definitely I'll tell you, AI may not replace a doctor, but a doctor not using AI will be replaced by a doctor using AI.
Perfect. I think that's very aptly summarized. A round of applause. So doctor not using AI will be replaced by AI. But I think some of the things you said, sir, are very, we're seeing that in the reports, in the trends. Home healthcare is going to be a $30 billion market. And I think we are already primed to a lot of home care, quickly getting things on Blinkit. Now you get pharmacy drugs also, you get lab tests also, so I'm sure care is moving. But that's a perfect segue for me to ask Dr. Geeta. Ma'am, you've been working and implementing a technology for screening, which is very much towards the preventive of breast cancer, which is one of the leading causes of cancer, and you're using AI and a lot of technology. So how do you think in the next 10 years, by 2040, it will change things for you and the ecosystem that you're in?
That's a good question.
So there should be a mic with AI which will detect that it's off.
Hello.
and
Yeah,
on.
this is good. So before I take that question, I want to make two comments. One is, maybe I was born in the midst of Deccan Herald. Like my father read it every day, probably my grandfather, I don't know. So it's like, being on stage with Deccan Herald sponsored is pretty good. Secondly, Mr. Moderator, Dr. Jagdish, is, how many of you know he does like wonderful medical comedy? I think you should Google. Sorry, I'm promoting you. It was not intended, but I'm a big fan of him. You should see, it's so lovely, simple events in the hospital. He kind of humorizes it, and hats off to you to make things so beautiful, actually. And he passes a message as well. So I am subscribed to your channel or some WhatsApp I keep getting from you. So if those of you haven't done it, please look up. Now coming to the point, yes, we've been using AI for detecting early breast cancer. And it's a portable test which can be done anywhere. And it's just a simple thermal imaging device which measures the temperature variations on the chest and converts that into a breast health report pretty much automatically to triage to say whether the person is red, yellow, green. And people who are red can be brought to a more detailed diagnostic workup. It's not a confirmatory test, but it's a good first-level testing where you can filter out 70 to 80% of women who may not need the next level testing. And this is very useful because for breast cancer, for example, only 1.3% of women do the required mammographic screening today. 98.7% of women are detecting their cancer by hand, which means it's mostly stage 2 or 3. And I have a breast specialist sitting next to me. But anyway, so with this, we've been able to make things quite a bit work, and it's got adopted in some of the northern states quite well, in Punjab, Maharashtra, UP, etc., even Uttarakhand, Chandigarh, and as well. Now, talking about 10 years from now, I would completely second what Dr. Somashekhar sir mentioned, that definitely we need to move from sickness care to preventative, proactive, rather than reactive kind of. And there, I believe AI-based medical devices can be a huge boon, right? One, as Sir mentioned, at-home devices. But what I'm very passionate about is how this AI-based medical devices can bridge the gap between the haves and the have-nots, even within the urban ecosystem, the rural and urban ecosystem, and of course, developing and developed countries. And AI can be such a boon in two ways. One, it can be used to develop such triage tools, which we really see being used today in cancer. Breast cancer is one. Cervical cancer, we have tools. Oral cancer, we have tools. Of course, eye-related diseases, we have tools. Chest X-ray analysis, we have tools. Because we know that doctors are sparse and radiologists are more sparse in general. So it's really important to empower the health worker with tools that can make her feel more powerful, and also identify the person who is at high risk at the right time and bring to the more sophisticated infrastructure, which is mostly in the urban areas. So that, I think, is one big place where healthcare divide can be really bridged using AI. Same in urban ecosystem as well, because if you see a doctor like Dr. Somashekhar sir, right, he'll be pounded with, patients, right? And I'm not sure whether he'll get time to have coffee, and I'm surprised that he's able to come in for this, right? I know how busy he is. So now, if you can actually use this kind of triage tools, even in a hospital like that, and almost like a medical intern or alongside a medical intern who may make a mistake, then there is again, prioritization of high risk, high priority people who get better attention, faster attention. Because even 2 weeks delay can be major fatal things in many of the diseases. So I really feel very strongly about this bridging. And going further, I feel that 10 years from now, and it's my vision, and we are already working towards that, is more like an ATM machine, right? Literally, or a box where a person can enter. And she comes out, and there will be a report saying, these are the places where, these are the doctors you need to go to, or these are the places that looks like a small abnormality, go and get this done. Of course, wearables are always there, but this kind of ATM machine. So we've already, for example, expanded our thermal imaging-based analysis from breast to any part of the body. it's still not regulatory clear. So it's really possible to have a quick view of where are these cells going wrong. And then, of course, detailed diagnostics we have to go. So hopefully, like we have, many of us have cars with annual maintenance. I think we need to start using AI for annual maintenance rather than, fixing it only when it breaks down. I think that can really happen.
That's very well said, Dr. Geeta. I think we are only 4.5 minutes left, but I also don't want to leave the audience left out. So I can probably take one question from the audience that can be open. But sir, before you ask your question, quick disclaimer. I was once on the panel like this, and I did not get to talk at all, but an audience member spoke more than all the panelists. Okay, so I know that there are those, that is a good idea, but but for now, if you have a very specific question to this particular topic that ends in a question mark, I would love to hear it. So you have a question you've been very eager to ask. So maybe we can open that question to the panel. Yes, sir.
Very interesting perspectives. A very important point was made about home care and home treatment.
Yes.
Is this going to be cost competitive? Is this going to be cost competitive? And when is this going to become commonplace?
So is home care and home products in health going to be cost competitive?
Home treatment also.
Home treatment is going, whether is it going to be cost competitive? Is that, sir, would you like to take it in terms of implementation from the government standpoint? Will you be able to?
Cost competitive, and is it going to become a commonplace? Is it going to become a common thing in the coming years?
So let me rephrase. So from the government standpoint, how do you think you can accelerate home healthcare and home treatment? Is that something in the purview that you're looking at?
Very philosophical type of question, and I don't know how to answer. In government, we provide the services free. So the cost is to the government. To the person who is availing the services, it is free. But a lot of ideas, what Dr. and she said, these are coming now. We do this program called Rashtriya Bal Swasthya Karyakram, in which all the some 4 kind of conditions of Anganwadi to 18 year of school children is being done. So till now we used to do with our traditional thing. Now other day only we had a presentation by some pediatrician only, and all kind of new equipments have come to the extent that they will take a picture of your cornea. It goes and then it can even detect what is your spectacle power. It can detect other conditions. It will take picture of your ear. It will detect what are the conditions. It will take picture of your mouth. It will detect. So these things. Now with that we also came to know this hemoglobin. Till now we used to do this prick and test with the blood. Now this new equipment has come. You don't need to do that. So it is just you place your finger on some light. So these are the kind of things I'm sure we live on hope. So it will be coming. All this is not very far, I think. We are already seeing some of this.
Wonderful, sir. Wonderful. I think we have 2 minutes, so if you can have very short answers. So Manish, sir, as an industry, how would you address?
Thank you. So I just wanted to add to what sir said.
Sure.
As an organization, we will be more than forward-looking to partner with various governments centrally as well as statewide. We have some devices which are almost there, which are getting released. So as sir rightly said that, just do, let's say announce a camp body screening, okay? We have a device as small as this, which will do eye scan. It will just do a fundus scan, and it is going to tell you about diabetic retinopathy. It is going to tell you about retinal detachments if one has. So it is going to also predict your heart attack over a period of time. Okay? And these are also pretty like 90-95% accurate forecast. So that is one simple device. It's a handheld device, camera kind of a thing attached to your phone, and that's it. Secondly, we have a device called X-ray vision. So you just take an X-ray from chest down, and it is going to identify any anomalies in your lungs. Is there anything like a cardiomegaly, which means enlargement of your heart? So multiple detections can be done with a simple X-ray template. I don't know, people would have heard about, just take a simple X-ray, it will predict your COVID status also. So these simple devices are being actually developed by us as an organization, and we are looking forward to partner in a big way so that preventive health, which Somashekhar sir mentioned, that becomes norm of the day, and the whole healthcare burden on the government also can effectively come down.
Perfect.
See, if I have to answer in clear, is it going to be reality? 100% is going to be reality. Already the transition has started. The only thing about moving a hospital care to home care is safety and monitoring. Everything in this world is available. You give in hospital or home the medicines, everything. So you need a safe environment to identify when an intervention in hospital is required. So you can't place a doctor. Manpower is very expensive. That is where AI in home will triage you. 90% you are safe with what you're doing. 10% when you have to come. That's where AI comes. 100% it is there, it's happening. Is it cheap? No doubt about it. Always the cheapest way is your home food, not going to restaurant. Cheapest way is treating in your home, not in the hospital bed, which is the most expensive environment anywhere. Fourth thing, today see, you don't have to look through 1,000 cervical cancer smear to identify one cancer. You just put them to AI, it is far superior than a pathology doctor. Imagine one AI can screen 1,000 slides of all the camps and say, who is that one patient who had to come to hospital? Cheapest. It's already there implemented. Mammogram. You have to see 1,000 mammogram to pick up 2 cancer. Human being radiologist, how expensive is it? Full day they have to spend. AI, 2 minutes, 2,000, better than this. How much money, time we saved. So it is already a reality. Phase manner it is happening. Cheapest, easiest, error-free, definitely happening. So no doubt about it. Maybe in couple of years, we'll sit here and see that do we really need human fear, how to interface human being with AI, where they are required to monitor. No doubt about it.
Perfect. Ma'am, you'd like to add some last remarks?
Yeah, basically talking about the home care itself, yes, some devices are affordable, you're right. Some could be just simple attachments or even mobile app themselves like iCheck, etc. But some currently are a little on the expensive side. But the best part is India knows how to make it frugal, how to make it produce, how it is a shared economy. There are certain, shared devices, There is a sleep apnea company which sends your device. You just have to, I don't remember the name, you can Google out. So you can just register and they will send you the device home for 1 week use and you pay only for 1 week for the diagnosis and then go back. So we will, like Sir said, it will become a reality. How we will make it affordable. For example, we have made this breast cancer screening, which is like a 80 lakh rupee machine, which is mammogram, etc. At home, now it's $500. The device itself is $500. But yes, it can be used. You don't need to do every day, right? You need to do once a month, once a year. So the coupled with shared economy, the economics of the device itself comes in, and definitely it is going to be a reality because of the AI part.
Perfect. And to conclude, a couple of our products, we do entire body orifice screening at home, from cervical cancer to oral cavity to ENT, as well as lung function. And I think there is a lot more pull from the market for home-based care because it's more easier, and also you're not subjected to other diseases which also add to cost, time and exposure. But with that, I think we have a short time. This is a very big topic to discuss, but I think we've all ignited questions in our mind to think about and ponder about it. So I would like to thank all our panelists for their wonderful remarks and for Deccan Herald for this opportunity. Thank you very much, everyone.